Well, remember this company. A little over a year ago, Mylan Pharmaceuticals came under fire after making the strategic decision to skyrocket the price of their life-saving EpiPens by nearly 600%. Now, during the outrage over that price hike, many had to go without receiving the life-saving drug. Both Mylan's chairman and CEO, though, they didn't go without a pretty penny, receiving a payout of nearly $100 million last year. But if you thought this whole controversy was over because Mylan actually finalized a $465 million settlement with the U.S. Justice Department, think again. A new report out shows that the rate of severe allergic reactions to foods, just like peanuts, has increased by nearly 5 times over just the past decade. Now that, according to a new analysis of private insurance claims. Food allergy watchdog Robyn O'Brien joins us now from Denver, Colorado. Robyn, I guess the first question I have for you, of course, we remember very well the outrage over the massive price increase on EpiPens. Where do we stand today? Is it priced more reasonably?
You know, a lot's changed in the last 12 months. We saw incredible outrage from consumers. The Epigate furor hit hard and fast. Mylan introduced a generic. Quickly, the FDA responded, and Adamas Pharmaceuticals saw their product quickly ushered through the FDA. Auvi-Q returned to market at Valentine's Day of this year. So we see new competitors in the marketplace, and that has definitely helped the consumer. It's going to help continue to bring the price down. We had a congressional hearing in the fall of last year in response to the Epigate furor, and as you mentioned, there was outrage over the skyrocketing pay packages of those executives, and shareholders actually tuned in, much like we saw with Wells Fargo, and the shareholders revolted as well, calling for investors to address that as well. So there's been a lot that has changed, but honestly, we've just finished the first chapter. There is so much more to this story, and the report that's just out that's again highlighting the skyrocketing rates of food allergies in the United States with these insurance claims. 26% of those claims are related to peanut allergies, but 33% are related to food in general. And so what has changed in our food supply?
That's the key question, isn't it? Why has this exploded over just the last 10 years?
Over the last 10 years, and again, you know, when you look at that report, it wasn't just children that were filing for those insurance claims. 34% of the filings were adults. So what has changed? Are we allergic to food, or are we allergic to what's been done to it? And this has become an epidemic in our country. It's impacting us at absolutely every single level. It's impacting schools, it's impacting communities, it's impacting us at every level.
Has there a reason being given, Robyn? We know that this was done based on the analysis from insurance claims, but you mentioned the way our food is made, the way it's processed and all of that. Do you have any clues at this point as to why allergies are skyrocketing?
Well, I think what's interesting in this report that was just released was that 1% of the allergic reactions were attributable to food additives. So again, are we allergic to food? Are we allergic to what's been done to it, what's been added to it, how it's being processed? There is so much more that needs to be done, again, which is why we have only just completed the first chapter of this book. And I think what we need to do is to continue to bring the prices down of these pharmaceutical drugs that are being used to protect the lives of Americans around the country. And it's not just children anymore. We're seeing this epidemic reach across all age groups, all demographics, all ethnicities.
I wanted to get back to Mylan again, if I can, because I believe the amount was $465 million settlement with the Justice Department. Basically, that was involving the overcharging to Medicaid or of Medicaid. Was that enough? Was enough action, do you think, taken by against Mylan for what they did?
I think if you were to ask any family who was part of the price gouging that Mylan participated in, they would tell you it's not enough, because the families aren't seeing any rebate. They aren't seeing any recourse. They are not seeing any refund for the incredible overcharging that Mylan did over the last several years. This isn't just over the last year. This has been going on for a very long time. And when you consider how many millions of Americans now are struggling with food allergies, how that is impacting absolutely every single industry, including the airlines, this is an epidemic that has to be addressed. And I think $465 million for a company that has $11 billion in annual revenue is not enough. And so what we are seeing in response are consumers that are beginning to file these lawsuits against this corporation. They're headquartered in the Netherlands because of that tax inversion that we've discussed before. But this is not going to stop. And the reason that it is not going to stop is because of that report yesterday. We are seeing skyrocketing numbers of Americans that are now suffering from these life-threatening food allergic reactions, and it has to be addressed. Well,
with that in mind, do you have a friendly ear in President Trump, who's quite often taken a swipe at what he calls price gouging big pharmaceutical companies? If you could speak to him face to face, what would you tell him?
I would tell him that the future of our country is contingent on the health of our children. The economic strength of our country is contingent on our productivity, and this is something that we have to address, that we can address together. And I would invite any American participating to put aside party politics so that we can really address the future of our country and the health of our children.
Very good. We'll leave it right there. Robyn O'Brien, as always, thank you so much for joining us. It's hard to believe it's been a year since the EpiPens scandal. Thank you so much.